For more than 4 decades, I trusted a system the way a computer trusts its operating program. If the diagnostics showed green, everything was working. If the screen displayed normal, there was no error. If the data came back within acceptable parameters, the machine was safe to fly. That is how I lived my life. For 42 years, I served as a commercial airline captain. From my early days flying the DC-8 to commanding wide-body international aircraft near the end of my career, I accumulated over 30,000 flight hours. I carried families, business travelers, children, newlyweds, and grandparents at 35,000 feet. Every time I walked into a cockpit, I accepted responsibility for hundreds of lives. To maintain that responsibility, the Federal Aviation Administration required me to pass a first-class medical examination every 6 months. Not yearly, every 6 months. Blood panels, electrocardiograms, urine analysis, blood pressure checks, vision, hearing, full physical evaluation. If anything failed, my career would end immediately. Over 42 years, I passed more than 80 of those examinations. 80 times, doctors looked at my numbers and told me I was healthy. 80 times, the federal government certified that my heart was strong enough to carry hundreds of people safely across the sky. And all that time, something deadly was quietly building inside me. Imagine a computer server that runs flawlessly on the surface. The dashboard shows normal activity. CPU usage is stable. Memory usage is within range. No alarms, no warnings. But deep inside the hardware, microscopic cracks are forming in the motherboard. Dust accumulates. Circuits begin corroding. The monitoring software cannot detect it. That was my body. The tests measured electrical activity in my heart. An EKG checks rhythm, past damage, irregular beats. Mine always showed normal sinus rhythm, perfectly ordinary. But electrical signals can flow normally even when blood flow is dangerously restricted. The system was checking the wiring. It was not checking the pipes. My cholesterol numbers were acceptable. Not spectacular, but within guidelines. Yet cholesterol panels measure what is circulating in your blood, not what is sticking to your artery walls. Two men can have identical cholesterol numbers. One has clean arteries, the other has ticking time bombs. The test cannot tell the difference. Blood pressure readings? Mine were fine. But blood pressure measurements are snapshots, like checking network traffic at one moment. They do not reveal decades of microscopic injury to artery walls. The truth is simple and terrifying. The tests were designed to confirm that I could perform my job today. They were not designed to predict whether I would survive tomorrow. For most of my career, stress tests were not even mandatory. And even when performed, stress tests usually detect only severe blockages, typically 70% or more. You can walk around with a 60% blockage and pass a stress test with impressive results. You can feel fine. You can exercise. You can play with your grandchildren. You can fly airplanes across oceans and still be minutes away from death. I did not know any of this. The doctors never explained it. Maybe they didn't fully understand it themselves. Maybe medicine simply had not advanced far enough. But ignorance does not protect you. It nearly killed me. After retiring, I believed I was among the healthiest men my age. After all, I had been federally certified every 6 months for 42 years. If anyone was medically cleared for life, it was me. 14 months into retirement, I was playing golf on a clear October afternoon. The air was crisp. The sky was flawless. Somewhere around the 14th hole, I felt something unusual. Not sharp pain, not collapse, just fatigue. A strange heaviness, like my body was working harder than it should have been. There was also pressure in my chest, not pain exactly, more like someone resting a weight over my sternum. I dismissed it. I blamed age. I blamed retirement. I blamed reduced exercise. What I did not blame was my heart. Because 80 federal medical examinations had told me my heart was fine. I finished the round of golf. I drove home. I had dinner with my wife. I said nothing. That night, standing in the kitchen, everything changed in seconds. The pressure turned into crushing pain. My left arm went numb. Sweat poured down my face. In one crystal clear moment, I understood. This is a heart attack. Then darkness. My wife found me collapsed on the floor. She called emergency services and began CPR, a skill she had learned decades earlier and never expected to use. Paramedics shocked my heart twice before it regained rhythm. At the hospital, an angiogram revealed the truth. 3 major coronary arteries were critically blocked. 1, the left anterior descending artery, was nearly 85% obstructed. Cardiologists call it the widowmaker because when it fully closes, survival rates plummet. I was minutes away from complete occlusion. Emergency bypass surgery followed. When I regained consciousness, I asked the cardiologist how this could happen. I told him about my aviation medical history. I told him about the 80 exams. He said something I will never forget. Those exams are designed to see if you're safe to fly today. They are not designed to see what might kill you tomorrow. The blockages had likely been developing for 15 years or more. For half of my flying career, I carried passengers across continents with a silent time bomb in my chest. And nobody knew, because nobody looked. To understand what nearly killed me, you need to understand what is happening inside your body right now. Think of your arteries like high-pressure fuel lines in a jet engine. They are designed to deliver life-sustaining flow without interruption. The inner lining of those arteries, called the endothelium, is supposed to be smooth, flexible, almost frictionless. When it is healthy, blood glides across it effortlessly. But over time, small injuries begin. High blood pressure creates microscopic stress fractures. Elevated blood sugar irritates the lining. Inflammation, poor diet, smoking, even simple aging all contribute to tiny areas of damage. You cannot feel this happening. There is no alarm, no flashing red warning light. Your body, incredibly efficient and loyal, tries to repair the injury. It sends cholesterol particles to patch the damaged areas, the way a maintenance crew patches a crack in a runway. But the repair process is not perfect. White blood cells arrive to clean up excess cholesterol. They absorb it. They become swollen, foam-like cells. Over years, layers of fat, calcium, cellular debris, and inflammatory material accumulate. This is plaque. Here is the part most people do not know. As plaque builds inside the artery wall, the artery often expands outward instead of inward. This process is called positive remodeling. It allows blood flow to remain normal even while dangerous buildup is growing within the vessel wall. That means you can have significant plaque without any reduction in performance. You can jog. You can swim. You can pass stress tests. You can pass occupational medical exams. Everything appears normal. You feel fine. But fine is not the same as safe. The real danger lies not in stable plaque, but in unstable plaque, soft deposits with thin fibrous caps covering fatty cores. These are fragile. They can rupture without warning. When rupture happens, your body treats it like a wound. Platelets rush to form a clot. In minutes, that clot can completely block the artery. Total occlusion. No gradual decline. No polite warning. Just sudden catastrophe. This explains why so many people experience sudden cardiac death as their very first symptom. No history of chest pain. No dramatic episodes. Just collapse. That is what almost happened to me on that golf course. Looking back, there were warning signs. For 6 months before my heart attack, I noticed unusual fatigue during mild exertion. Walking uphill felt slightly harder. Playing with my grandchildren left me more winded than it should have. Nothing extreme. Nothing terrifying. Just subtle changes. I dismissed them. I blamed age. I had recently retired after decades of structured routine. Of course my endurance might decline. That seemed logical. I also experienced occasional tightness in my chest after physical activity. Not sharp pain, just a squeezing sensation that faded after a few minutes of rest. I assumed it was muscle strain, or indigestion, or stress. What I did not realize was that this sensation had a name: angina. Angina is your heart whispering that it is not receiving enough oxygen-rich blood during exertion. It is not dramatic like in movies. It can be mild, subtle, easy to ignore. If I had recognized it, if I had consulted a cardiologist and requested imaging of my coronary arteries, The blockages could have been identified months before they nearly killed me. Instead of emergency surgery, I might have had an elective procedure. Instead of cardiac arrest in my kitchen, I might have avoided collapse altogether. But I trusted the system. I trusted numbers on paper. I trusted decades of normal results. That trust almost cost me everything. After my surgery, I asked the cardiologist how long this had been developing. He estimated at least 15 years, possibly longer. That means during the second half of my flying career, while I was trusted with hundreds of passengers at cruising altitude, my own heart was slowly narrowing. And nobody saw it. Not because the doctors were careless, not because the regulatory system was malicious, but because the standard tests are not built to detect early arterial disease. An EKG evaluates electrical rhythm. A cholesterol panel measures circulating lipids. A blood pressure reading captures pressure at a single point in time. None of these directly visualize plaque inside coronary arteries. It is like evaluating an aircraft safety by checking cockpit instruments but never opening the engine casing. You are measuring performance. You are not inspecting structure. There are imaging tools capable of looking deeper, scans that measure coronary calcium, CT angiograms that visualize arterial narrowing. These technologies can reveal plaque before it becomes fatal, but many people never request them. Some physicians hesitate to order them unless symptoms are severe. And patients, especially those who feel fine, rarely push for additional investigation. I was one of those patients. After surviving that first heart attack, my medical life changed permanently. I now see a cardiologist regularly. I take multiple medications daily to manage cholesterol, blood pressure, and clotting risk. I have undergone additional procedures, including stent placements and further interventions. I live with the knowledge that my cardiovascular system has been rebuilt, and I live with gratitude, because I was lucky. Lucky my wife knew CPR. Lucky emergency responders arrived quickly. Lucky surgeons were skilled. Luck is not a prevention strategy. If my collapse had occurred 5 minutes earlier on that golf course instead of in my kitchen, I might not be here. If my wife had panicked instead of performing compressions, I might not be here. If emergency services had been delayed, I might not be here. When people say, I feel healthy, I understand exactly what they mean. I felt healthy too. I was certified healthy 80 times. Health, however, is not defined by absence of symptoms. It is defined by what is happening beneath the surface. And beneath my surface, a silent process had been unfolding for years. You may be walking around with similar silent processes right now. Not because you are careless, not because you are reckless, but because the absence of discomfort creates a powerful illusion of safety. I believed that illusion for decades. And illusions can be deadly. I am in my late 80s now. Every morning when I wake up, I am aware of something I once took for granted. The simple fact that my heart is still beating. After that first heart attack, I experienced additional cardiac events. I have stents in multiple arteries. I have bypass grafts rerouting blood around damaged vessels. I take medications daily to control cholesterol, blood pressure, and clotting risk. I undergo regular imaging to monitor what is happening inside my chest. My cardiovascular system today is not original equipment. It has been repaired, reinforced, reconstructed. And I am alive because of it. But I am also alive because of luck. Luck that my collapse happened at home instead of alone. Luck that my wife reacted instantly. Luck that emergency responders arrived quickly. Luck that modern surgical techniques were available. Luck is not something you should rely on. For 42 years, I operated aircraft with discipline. I trained for worst-case scenarios. I prepared for engine failures, severe weather, decompression events, system malfunctions. I never assumed everything would be fine simply because it felt fine. Yet with my own heart, I did exactly that. I trusted routine exams. I trusted reassuring words. I trusted the absence of symptoms. I never asked to look deeper. Today, you have options that many people did not have decades ago. Imaging technology can reveal coronary artery calcium. Advanced scans can show plaque before it ruptures. Risk can be measured more precisely than ever before. If you are over 40, have risk factors, or experience even subtle symptoms, unusual fatigue, chest tightness with exertion, unexplained shortness of breath, discomfort in the jaw, shoulder, or back, do not dismiss them. Do not automatically blame age. Do not automatically blame stress. Ask questions. Request appropriate evaluation. Have a serious conversation with a cardiologist who understands preventive imaging and long-term risk assessment. Do not wait for dramatic pain. Do not wait for collapse. Half of all serious cardiac events occur without prior warning signs that people recognize. Many individuals who suffer sudden cardiac arrest believed they were healthy just days before. I was one of them. If I had known what to ask for 20 years earlier, my story might have unfolded very differently. Instead of emergency surgery, there might have been early intervention. Instead of cardiac arrest, there might have been controlled treatment. Instead of depending on CPR in my kitchen, there might have been prevention. I cannot change my past, but you can influence your future. You do not have to wait for a catastrophic event to discover what is happening inside your arteries. You do not have to trust surface-level reassurance if your instincts say something feels different. Be proactive. Be informed. Be willing to look beneath the surface. I survived because of timing and intervention. You can survive because of preparation. Do it for yourself. Do it for the people who depend on you. Do it because the truth, even when uncomfortable, is better than a comforting illusion. For decades, I flew above the clouds believing I understood risk. The greatest risk I ever faced was the one I never saw coming. Now you see it. Do not ignore it.